care planning policy in the UK. Introduction to the module. This module will help you to know about clinical and social governance frameworks. You will also learn the different roles and responsibilities of particular health and social care providers. Topics to be covered: the role of the World Health Organization, quality in health and social care, factors when considering local needs, strategic management of resources, analysis of the structure and management of health and social care in the UK. The Health and Social Care Act 2012. The role of the World Health Organization. The World Health Organization, WHO, develops strategies based on evaluative research that will eliminate inequalities in health and social care across Europe and the world, increasing health and decreasing the burden of disease. The strategy of the WHO is based on three basic ethical values: health as a fundamental human right, equity in health and solidarity in action between and among all countries and their people, participation and accountability. The above values should be found in every health and social care team across the UK and Europe in an effort to promote the healthy lifestyles of each and every individual person. Quality in health and social care. Staff at all levels should integrate quality measures into their own work to help in the development of their service. Quality improvement can occur in a number of ways, which includes team working, demonstrating a commitment to your work and your colleagues in identifying problems and helping to find solutions. Role fulfillment, making sure that you fulfill your role, fully understand the role of others in the NHS, National Health Service, and respect their different approaches to practice. Policy development, contributing to and carrying out local and national policy, including legal and ethical regulations and professional codes of conduct. Using quality as a focus helps us to recognize where services can be improved or where they are effective in meeting local needs. Poor quality care will ultimately cost the organization, whether in the forms of legal costs or the replacement of damaged resources. One of the most important aspects of providing high-quality health and social care is training staff to do their work efficiently and effectively. If practitioners do not know how to provide high-quality care, the core objectives of the service will not be met, no matter how much money is provided to the service. Factors when considering local needs. The following factors should be considered by all health and social care planning teams. Individual needs. How many people in the community require a specific service based on their individual assessments? Local needs. Local needs of specific health and social care groups. Accessibility. Whether the service is available locally or whether it is provided by another organization and can be obtained. Resources. Each local area will develop its resources as required in response to local needs. However, these resources will need to be evaluated on a regular basis to ensure that they are an effective way to deliver services. Strategic management of resources. Managers are usually expected to provide a plan of care based on the needs of the population, in considering the clinical and social governance agenda, when evaluating strategic management and resource allocation. They will also be required to submit regular reports or audits on how their resources have been managed and what training needs have been identified and provided. Managers will also be expected to show evidence for why resources are being organized in a specific way, as well as how they have involved clients in gathering that evidence. Finally, Managers and their organizations will need to show how they have managed any risks to individuals and the organizations themselves. Analysis of the structure and management of health and social care in the UK. The hierarchy of care. Major health and social care decisions are made in Parliament, or the governing body for each country within the United Kingdom. The government creates social policy and, in some cases, legislation to assist local and regional departments in determining how their budgets should be spent and procedures to be developed. This can be based on research evidence for certain treatments or services in order to promote health and independence. Strategic and regional health and local authorities. These authorities are in charge of deciding how services in their areas should be developed. This is important because the government is aware that some areas of the country need different services from others. Local authorities, like regional health authorities, are in charge of determining how non-healthcare services are delivered in their communities. This involves health-promoting activities on a wider scale. Primary health care teams, local health boards and health and social care departments. These teams are funded by the strategic and regional health authorities. These have an influence on how healthcare resources will be dispersed in primary care in each county. They are accountable to the strategic and regional authorities. They also need to provide justification for how they decide to allocate resources. They are composed of a multidisciplinary team or board. Therefore, they should be able to agree on healthcare providers using a whole care or whole systems approach. This means that they considered all of the healthcare needs of a group of people, rather than just one aspect, for example, medication. Social services departments. Social services departments are located within local authorities and provide health and social care to people of all ages, from infants to very old people. Social services, therefore, have to manage a wide diversity of needs and often work very closely with the voluntary and private sectors. Social services departments also have a wider involvement in the local community and in identifying and addressing the needs of that local community. Primary health care. Primary care is known as such because it is usually the first point of contact for an individual or group requiring health care. This generally means the GP surgery, where a patient will be assessed by the doctor or nurse and either provided with care or referred on to secondary care or other services. The primary care team provides health promotion, health education and the monitoring of healthcare for people with mild to moderate needs. Primary care services are responsible for the budget for prescription medications as well as helping their patients in selecting and planning appropriate health care from secondary services. Secondary health care. Secondary care can only be accessed directly through accident and emergency departments. All other routes into secondary care must be through the primary care team. Secondary care provides more specialist interventions and treatments for disorders. Voluntary and private sector care. The voluntary and private sectors are creating an increasing and rapid contribution to health and social care delivery. Services are organized around areas that may not already be covered by statutory provisions and are largely the result of market-driven and consumer movements. The Health and Social Care Act 2012. According to the Health and Social Care Act of 2012, each clinical commissioning group, CCG, must take into account the requirement to reduce inequalities between patients with respect to their ability to access health services, reduce inequalities between patients with respect to the outcomes achieved for them. Promote the involvement of patients and their carers in decisions about the provision of health services to them. Enable patients to make choices with respect to aspects of health services provided to them. Summary. In this module, you have learnt: the World Health Organization, WHO, continues to develop strategies based on evaluative research that will reduce inequalities in health and social care across Europe and the world, promoting health and reducing the burden of disease. Quality improvement can occur in a number of ways, including team working, role fulfillment, policy development. Using quality as a focus helps us to see where services can be improved or are working well in addressing local needs. Each local area will develop its resources as required in response to local needs. Major decisions about health and social care are made in Parliament, or the governing body for each country within the United Kingdom. Thank you. This is the end of this module. Thanks for watching. Happy learning.